Welcome everyone to BayCare Presents. Very excited about this topic. Being an exercise physiologist, I always love when we talk about how the body moves. And today we have Dr. Mixa with us, and he's going to be talking about summer sports injuries and how we can treat, and more importantly, how we can prevent. So I'm going to turn it over to you, Dr. Mixa.
Thank you for having me. Thank you for everyone for joining. So yes, I'm going to talk about the summer sport injuries, treatment and prevention plans that we can have. The topics I'm going to discuss are some of the most common things that we see with sport injuries: rotator cuff tears, tennis, golfer's elbow, low back sprains, meniscus tears, osteoarthritis flares, and ankle sprains. So the most common sports we see, things such as pickleball, tennis, see a lot of injuries from that. We see some injuries from golfing, cycling, running, jogging, hiking, walking, and skiing. So first topic I'm going to discuss is rotator cuff tears. In most cases, rotator cuffs pain starts with pain mostly over the lateral or the outside of the shoulder. Patients can have partial or complete tears of the shoulder, and it usually involves some of the rotator cuff muscles. So on the bottom of the screen, you can see some of these muscles that come over and attach to the humerus or the shoulder. There's four muscles that come. The top one, the supraspinatus, is the one that patients most often tear, and usually occurs with some either repetitive overhead range of motion, somebody trying to pick up something heavy. In some cases, as it says here, up to 30% of people over 70 can have asymptomatic tears. So you may be walking around with a tear and not even know it, but sometimes you can exacerbate that tear, make it worse. So patients usually have a lot of shoulder pain, especially weakness. Weakness was with bringing the arm straight, bringing the arm up overhead or in front of your body. They'll have limited range of motion, and have difficulty with, especially with anything overhead. So treatment for this, we usually try to be conservative at first. Try some rotator cuff exercises. You can look a lot of good exercises online. Stretching, especially before activity, stretching the arms can help prevent injuries as well. If you are having shoulder pain, taking some things such as anti-inflammatories, Motrin, Tylenol, Aleve, ibuprofen, those things can help. In some cases, we'll do a cortisone shot to help calm things down. There's other injections as well out there, PRP and even the stem cell stuff, which are costly, but sometimes we can try. But my point is that there's all these conservative managements. If the rotator cuff tear does occur, we usually start things off very conservatively before jumping to get an MRI to see, is there something that we need to fix surgically? Sometimes there is, and there's surgical options to repair this rotator cuff or even shoulder replacement in some cases. But in most cases, most treatment plans is trying anti-inflammatories, possibly a cortisone shot, and especially a focus on the rotator cuff exercises to help this, sometimes the tear strengthen or help strengthen the muscles around the tear. Another common injury that we see is tennis elbow or golfer's elbow. They're actually two different things. Tennis elbow is more on the outside and golfer's elbow is more on the inside. But presentations are somewhat similar. You have a burning, aching pain over the outside of the elbow. Both have kind of loss of grip strength. With tennis elbow, it's more people have issues opening a jar or with a back, doing their tennis backhand or pickleball backhand. That's hence the name tennis elbow. And it also is worse with like wrist extension. Golfer's elbow, more on the inside of the elbow. Patients will have a little bit more pain in the morning or after inactivity. The elbow will also feel pretty stiff, but they'll also have difficulty with grip strength and issues grabbing objects, especially such as like their golf club or a racket. So what can we do? Again, stretching for all these injuries. Stretching is the most important thing I think anybody can do. Stretching before 10, 15, 5-10 minutes before an activity, and then stretching after activities. When things do hurt, sometimes activity modification, trying to avoid some of the activities that do hurt the elbow. So if a certain lifting motion hurts, try to lift objects in a different way that doesn't make it hurt. In some cases with tennis elbow, we try there's something called a tennis elbow band that you can get. And sometimes that helps calm things down. Those are sometimes you can get them from your orthopedic or family doctor or a brace place, or you can even get them over the counter at like CVS or buy them off Amazon. If things aren't working, again, anti-inflammatories, ice, heat, stretching, uh, sometimes physical therapy can be very helpful. And then if those things aren't working, sometimes there's medications out there. There's some new Tylenol creams that are over the counter, or Voltaren gel, which is actually has diclofenac, which is actually an anti-inflammatory that can be pretty helpful, especially for kind of tendon injuries and things like that. Um, if all else fails, again, there's some injections that work pretty well. Cortisone works pretty well. PRP actually has been shown to actually have a pretty good effect with tennis elbow. And then if all else fails, these things can take months and months and months to go away. Sometimes 6 months to a year for these things kind of calm down. But we really leave surgery for as a last option for any patient. Low back sprains. I'm sure if we were all in a room and I asked who's ever hurt their back before, probably most of us would raise our hand. Back pain is usually, located in the lower back, usually more one-sided, or more on the right or more on the left. It worsens with movement, bending, twisting, or can be kind of exacerbated by things such as swinging a golf club or swinging your tennis racket. And it gets worse with prolonged sitting and standing. So anytime anyone throws out their back, we always say the most important thing is to keep moving. Do not lie in bed all day. Keep moving. Prevention wise, most important thing is stretching. Stretching your legs, your hamstrings, your quadriceps, your hip flexor muscles. Doing exercise prevention, which is really important, is doing things such as core exercises that work on your abdominal muscles to keep those things nice and strong. Those things will help prevent it. But if you do throw your back out, stretching is important. Stay moving is more important. Is super important, and taking some possible, under the direction of a doctor, muscle relaxers or any over-the-counter medications. So, but with these back flares or back sprains, you can have also muscle contractions as well. The back will feel like it's locking up. Patients will have difficulty with activities such as bending, forwarding, or standing straight, and also with twisting. But it can be really painful, and it can take several days to get better. But like again, cannot emphasize the importance of stretching to prevent the back. Back braces aren't really used as much, but if you're doing something that's kind of a higher risk activity or doing some heavy lifting, it's not a bad idea to wear a back brace. Other than that, especially working on your form, especially if you're doing a new activity or a new sport, working with the trainer to figure out what's the best form to protect, working on your posture, things like that. Um, and again, symptoms that are really worrisome. Back pain is one thing, but if you ever have any symptoms such as such as new numbness or tingling or weakness in the legs or upper arms, those are more warning signs and kind of, should get you to maybe see a provider sooner rather than later if you're having those kind of symptoms. It can also exacerbate some sciatic-like symptoms too. But definitely, if you're having any shooting pain down the legs, numbness or tingling, any significant weakness, seek a medical professional for further evaluation. Meniscus tears are very common as well. Meniscus tears usually occur in the knee, but usually from some type of twisting injury or some type of pivoting. So it can happen to people when they're playing tennis or even during their golf swing. Pain is usually located more on the inside or the outside portion of the knee, and usually will occur if it's an acute meniscus tear, meaning you just injured it, had a significant injury. The knee will kind of sometimes swell up like a balloon as well. If it's a degenerative tear or a tear that's kind of been there for a while, it's kind of wear and tear, that can kind of flare up once in a while. But usually in a lot of cases, patients will have some knee swelling, will have tenderness along the joint line. And the most important thing with the meniscus tear is, are you having mechanical symptoms? Is the knee giving out? Is it buckling? Is it locking up on you? If that's the case, then some of these tears, which you can see in the bottom corner of this screen, these tears, sometimes the tear will actually get stuck between the femur and the tibia. It'll kind of get stuck between the bones when you're flexing or extending the knee. And that'll cause the knee to kind of give out or buckle, almost like a pebble kind of getting stuck in a gear. So And in those cases, that will kind of warrant us maybe possibly to get an MRI. Again, it's really important to focus on, proper shoe wear when you're doing activities, working on stretching before, and just being careful on things such as uneven ground, especially if you're doing something such as hiking or jogging. Um, uh, Treatment-wise, if you do have any swelling in the knee, most important thing is to ice, elevate, can put a wrap, an ACE wrap, or a knee brace on there, so compression, um, and you can take some anti-inflammatory medications. Usually first-line treatment for meniscus tears, besides over-the-counter medications, sometimes getting into physical therapy to work on strengthening. If it is kind of an acute tear or one that just happened, or even a degenerative tear, sometimes we can try an injection into the knee to see if that helps give you some pain relief. And then if the symptoms aren't improving, usually get an MRI, evaluate for something. Do we need to do something to fix this surgically? So in younger people, sometimes we will repair the meniscus, but usually in older people, or depending on the tear, we'll just go there and kind of clean the meniscus and clean the tear out, and that usually gives patients significant relief. So osteoarthritis flares can happen anywhere in the body, most commonly in the knees, hips, shoulders, and hands. And usually it's because patients overdo it, or sometimes they have a fall, but can be caused by can cause stiffness, especially at rest. Patients usually have a lot of pain. We call it startup pain, pain where the first couple steps in the morning are really bad, or the first 30 minutes of the day, my hands hurt, my shoulders hurt a little bit better. But as things get things keep moving along during the day, your arthritis kind of calms down a little bit. But usually the starting up of activities is what really bothers people. So, but arthritis flares can kind of be exacerbated if you kind of overdo it one day. You do go on a longer jog, or go on a longer walk, or go out there and play a longer game of tennis or pickleball. So, and in those cases, sometimes the arthritis can flare and can present kind of as knee pain. Sometimes the knee will feel full, or the knee will be kind of swollen. Can have some difficulty with extension and range of motion. The arthritis can also kind of present as kind of like grinding, crunching, popping, with flexion and extension of the knee. Again, just like kind of a meniscus tear, similar things to do is stretch before activities, stretch after activities. If the knees or other joints are really bothering you, can ice, elevate, try some heat, other treatments, anti-inflammatories, over-the-counter medications. But we try to treat these things conservatively. If things aren't getting better over long periods of time, there's always surgical options to consider. But trying to manage this with conservative management is usually our first step with arthritis. If you do have something such as gout or rheumatoid arthritis, sometimes it's worth talking to your family practice or internal medicine doctor about treatment options for those, because there's a lot of really good medications if that's the kind of arthritis you do have. So ankle sprains are very common as well. It can be like an already presented as an immediate sharp pain around the ankle, sometimes the inside or the outside of the ankle, and sometimes both. Usually pretty painful with walking. Patients present with swelling around the ankle or bruising. You can see in the bottom of the screen here, this patient has some bruising around the ankle. That's usually pretty common with an ankle sprain. So they'll have this black or blue appearance, and sometimes it can take a day or two to kind of appear, and it will slowly get better with time. One thing that's important, you have a bad ankle sprain and having really difficulty walking, is to rule out a fracture. But as long as it's just a sprain, most of these can be treated conservatively. In most cases, we'll put patients in a boot or a brace for 1 to 2 weeks. But we want to keep people moving and keep them walking and keep them moving as much as they can, because that actually helps their recovery process. So, but it can take 4 to 6 weeks for these things to get better. So important in prevention is wearing proper shoe wear. Don't be wearing high heels and going out, to do some sports or doing long walking. Try to focus on wearing comfortable shoe wear, especially nice, big, stable tennis shoes. If you're out in the trails, wearing some high top shoes. or some type of sports specific shoes, sometimes wearing, tennis shoes or other shoe wear that's specific to the sport you're playing can be, very helpful. Um, and in most cases, we really don't want to immobilize them for too long because patients, the ankle can get stiff or weak. So trying to focus on uh, symptomatically taking some medications to help with the pain, but most importantly, keep moving, keep stretching, and things will usually get better on their own. So overall, prevention strategies, very important. Strength and conditioning. So these things builds muscles around the joints, especially in like things such as shoulders and knees. And doing some strength and conditioning exercises can really reduce risks of injury from up to 20 to 30%. So focus on kind of low impact exercises, resistant bands, those rubber bands that they have in the gym, body weight squats, low weight, high rep things, core strengthening, focus on strengthening the muscles in your abdomen to help protect your back and other structures. So, and we recommend doing this at least 2 or 3 times a week. It's tough. Everyone's busy. It's tough to do a lot, but if even 2 or 3 times a week can have significant benefits for people. So balance and proprioception training is also an option. So this improves stability and can kind of reduce fall-related risks up to 25%. So, and this involves exercises like single leg stands, Tai Chi, yoga. They have new wobble board training. And just doing this for 10 or 15 minutes 3 times a week can really reduce the risks for injuries. So, getting in with a physical therapist or a trainer or a friend, or even, there's a lot of really great YouTube or internet videos out there that can kind of guide you in a lot of these strength and conditioning or balance and proprioception trainings. So super important, proper warm up and stretching. I really can't stress this enough. I think this is really the thing that causes a lot of injuries and also can lead to other things such as arthritis is we don't stretch, we don't warm up enough. So 5 to 10 minutes is all you need of stretching before activities, and also recommend doing it after activities. So like examples, stretching the shoulder out before playing pickleball to protect the rotator cuff, that can prevent injuries like this from occurring. So use of supportive gear. So either to prevent air injury or sometimes after in the recovery process, this can help stable the joint, absorb some of the impacts or sprains and fractures. Again, wearing sports specific shoes. Sometimes if you have any, if some people are flat footed or kind of have a cavus foot, sometimes wearing specific shoe inserts can be very helpful. And if you're injury prone or in the recovery process, sometimes wearing a knee or ankle brace can make you feel a little bit better. Sometimes just a compression sleeve keeps the knee a little bit warm, especially if you have arthritis. That can kind of keep, especially during the winter too, keeps things nice and warm, gives you a little bit of biofeedback. Something if you don't like wearing it, don't wear it. But a lot of people find some benefit from it. So if you're having things such as hand pain or get tennis elbow or golfer's elbow, sometimes thinking about bigger grips, especially just kind of a push more now towards bigger, more ergonomic grips for racket or club-based activities. So, and as we get older, things kind of change. Doesn't mean we can't not stay active, but sometimes the activities we were doing before or need us to be a little bit more injury prone or just cause more pain. So doesn't mean we can't do the same, stay very active, but we can modify our activities. So which reduces stress on the joints, can prevent, arthritis flares, can prevent, in higher risk activities, prevent things such as rotator cuff or meniscus tears. So a focus on things such as swimming. I think swimming is one of the best things that anybody can do. It's low impact. It's easy on the joints. It allows people to get good resistance. You can swim, you can do water aerobics, you can do just grab a paddle and start kicking, or aquafit. Things such as yoga, I think is really great. It works on focus on stretching, but also a lot of stabilization and strengthening. So, and doing these things such as running, skiing, or doing something more higher impact activities, switching to something a little bit safer can still give you all the same benefits of exercise, but not put you at risk for injury or progression of more chronic issues. So nutrition and bone health is also very important. So this helps keep our bones strong, helps repair muscles after activities or after injury, and can reduce things such as stress fracture. So the recommendations are usually 1,200 milligrams of calcium and about 800 to 1,000 IUs of vitamin D daily. A lot of us are actually, even though we live in Florida and think we get plenty of sun, there's a lot of people that are vitamin D deficient. So also focusing on including protein-rich foods can help keep us strong and help with muscle repair. So there's also focus on some dairy or fortified foods. So if you have questions about, I mean, I think food is super important. It really affects what keeps us healthy. What we put in is what becomes us. So it's a very, uh, important part of our regular health. So, there's plenty of very good dietitians out there, and there's a lot of good information on the internet. But getting a good diet plan and can really, I think, help keep you healthy or help you recover from any injuries. So, also, I think it's really important to work on going to your regular medical screenings. So you can identify risk factors such as osteoporosis, osteoarthritis, and your medical doctors, your internal medicine, your family medicine doctors can tailor things to keep you healthy and prevent any further injuries or help any chronic conditions. So going to your annual checkups, women over 65, especially getting their bone density scans can be very helpful. So things such as a DEXA scan helps scans our bones. So those are important. Can assess for osteoporosis or osteopenia. And also if you're going to start any new activities that's kind of intense, it can't hurt to get like a pre-sports physical from a doctor to make sure you're healthy enough to participate in those sports. So overall, conservative management is the first step after any injury: rest, activity modification, what we call the RICE protocol, RICE as compression, elevation, heat before activities. Have an injury or things are some chronic pain issues, focus on non-steroidal or anti-inflammatory drugs. So the NSAIDs, Tylenol works pretty well too. You can take both together sometimes if you're able to, if your kidneys and your liver are okay. Focus on physical therapy or sometimes occupational therapy can be helpful, working on stretching, strengthening, and other modalities to help you recover from any injury. Bracing, supporting devices, knee braces, ankle braces can be very helpful. If those things aren't working, we go to the next step, which is injections, sometimes corticosteroids, PRP. There's hyaluronic acid injections as well. And there are some stem cell injections out there that are provided by some people. And those can all help calm things down, give you some pain relief. If all conservative management fails, that's when we move to going to things such as having surgical intervention, either for to repair or replace what's been broken or injured. So if that's the point you get to, then consultation with an orthopedic surgeon, a spine surgeon, or a specialist might be needed. So overall, I just thank you for everybody for your time. Just a little bit about myself. Moved here to St. Petersburg this past year. I joined my father, my mother, and my sister in practice. We're down in South Pasadena. I go to most of the hospitals here in St. Petersburg. Focus on general orthopedics, so all orthopedic conditions. And my fellowship or my specialty training was in hip and knee replacements. So do some of the robotics, some of the direct anterior approaches for the hips. But we see kind of tip to toe any problems you have, and we're very happy to help out anybody and be a part of our kind of family practice that we have. So thank you so much for everybody for your time, and please let me know if you have any questions.
Thank you so much. I have to say, one of the things that I love most about your talk and listening to you is your holistic approach, and the fact that you really look at that prevention piece, because a lot of times coming from someone with a surgical background, that's not always the first place they go. So
Yeah.
really appreciate that. And I know a lot of people on this call know that I'm an exercise physiologist and a clinical health coach. So to be able to see all of the great movements that you gave people, and I always like to put my plug in for toothbrush exercises, add a little movement snack to your day. You can do little 5-minute snippets throughout the day that'll help become a little bit it more of a habit so that you can get that stretching and that quality movement in our sphere of function around, so we can continue to play all the sports that we love as we age. Looking
Absolutely.
at the
That's not, yeah, that's, I don't think that's stressed enough. I totally agree with you. Yeah.
So I appreciate your emphasis, because as you just wove that through the entire talk about the importance of prevention, not to, to eat well, to eat the supplements that we need, you make sure we're getting that into our food and movement and all of that. But looking at the
Mhm.
questions, some of the things that came out was your ideas of, what do you think about the barefoot shoes that are out there?
Yeah. So I think there's some good barefoot shoes, and it's one of those things that if the shoes feel comfortable, you can wear them. So there are some like exercise specific shoes such as those where, if you're doing something such as yoga or kind of a foot based activity, it can be beneficial in terms of strengthening the feet. The only issue is sometimes they're not as well padded. So sometimes for higher impact activities, it might not be the best thing. But as long as the shoe isn't causing any issues, it isn't causing any pain, such as plantar fasciitis, uh, you know, or any other, forefoot pain, pain in the toes. If it's something you can tolerate, and it feels like it gives you an advantage of whatever activity that you're doing, I think it could be beneficial. I think just most importantly is a nice, comfortable, um, well padded shoes. They have actually really a lot of great tennis shoes out there for all ages, and they're actually kind of stylish now. But that provide enough support. With the barefoot ones, sometimes there's a concern about maybe not enough support. But if if you feel comfortable wearing them with the activity that you're doing and it doesn't cause you any pain, then I think it can't hurt to try them.
So what I'm hearing is it's good to have a variety of sneakers. And my husband will say I have a little obsession with having a variety of sneakers to fit the sport that you're doing. You want a shoe that's going to let you move laterally if you're playing tennis. You want to make sure that if you're hiking, you got that ankle support you need. So you want to make sure that that footwear fits the appropriate activity that you're doing.
Exactly.
Perfect. There were
Mhm.
a lot of questions on injections. So people were asking about your thoughts on the RPR and the rooster comb injections and stem cell therapy. So I think I'm
Mhm.
just going to throw that at you. Your thoughts on those? When are they appropriate?
Mhm.
And when may they not be the best path for you?
Yeah, injections are a staple of our practice. We do a ton all over the body for arthritis, for acute injuries. Uh, a lot of it comes down to, in some cases, just cost. Cortisone is cheap. It's the kind of gold standard. We use it for pretty much all of the conditions, and it's usually covered by insurance. And all the other injections are helpful or possibly beneficial, but nothing has been proven to be significantly better than cortisone injections across the board. So usually we start with a cortisone shot first and see how it goes. I do have patients that come and ask me saying, I want a PRP injection, I'd like a hyaluronic acid injection, and those are options. Issues is they're not usually covered by insurance. Some cases, hyaluronic acid can be partially covered, but PRP usually isn't. And stem cells are very expensive in the several thousands of dollars, um, and are definitely not covered. So those are options, but usually we'll start with a cortisone injection first. If
What are the
that's working,
rooster comb fit in there? Or is that part
yeah,
of?
yeah, the rooster comb are the hyaluronic acid
Okay.
injections. So, and they can be in some cases a little bit falsely advertised. They do a good job. They usually try a cortisone injection if that gives them some relief. Sometimes we'll try a hyaluronic acid or a rooster comb injection, and that kind of just like fluffs up the cartilage and kind of lubes up the joint, and hopefully gives patients about 6 months to a year of relief. So those are injections, especially I think they're mostly just approved for the knee right now. In some cases, the hip. But those can be beneficial for, hip and knee arthritis, but you can't have bone on bone arthritis. It's not really going to do much. You have to have a little bit of cartilage left. So someone who's not ready for a knee replacement, that's trying to postpone it, or, has some mild arthritis, hyaluronic acid or rooster comb injections can be pretty helpful. The PRP is, again, there's a cost involved in that, but it's basically as good as cortisone, but it has seen a little bit in studies, a little bit uh, possible more benefit for things such as some of the tendon issues, such as tennis elbow or Achilles tendonitis. It may be a little bit more beneficial for some of the tendon injuries, but it works just about as good as cortisone for knee and other knee and shoulder stuff, but usually it's just a little bit more expensive.
What is your thoughts on the chondroitin glucosamine supplement that some people are taking regularly?
Yeah, I think it's one of those things that hasn't been proven. It theoretically should help, but uh, the studies have shown that it just hasn't been necessarily recommended for everyone because we're not sure if it really has a benefit for everyone. So it's one of those things. If someone takes it, I say, does it make you feel better? Great, then keep taking it. We don't routinely prescribe it to everybody, but it's something that I think as long as you can tolerate in your diet, it doesn't upset your stomach or anything, and you feel like it works and keep using it. But it's something that can't hurt to try as long as you don't have any side effects.
All right. Moving on to a little
Mhm.
different topic now. Someone
Mhm.
had a torn meniscus repaired. When can they start running again?
Usually, it depends on the meniscus tear. So it definitely depends on what your surgeon has done. So if they did just a meniscectomy, uh, usually we have patients kind of take it easy for the first 4 to 6 weeks. Um, but in some cases, after a month to 3 months, some patients can get back to some light jogging or running. It really depends on what your surgeon did. I've had patients not uh, follow instructions and be running after about a week, but that's not recommended. We usually try to hold things off for at least the 4 to 6 week mark. But I would refer back, talk with your surgeon, see how bad the tear was. Sometimes there is a repair, which means the recovery process is much longer. Um, but yeah, for that person specifically, I'd see what their
Yeah.
surgeon said, make sure what they did coincides with what their post-operative recovery plan was for them.
There are some people who just never want to stop running. I always say there's deep water running to push them back in the pool, or if they're working with their physical therapist and their surgeon, they do have the Alter G treadmill sometimes where they can get people to start doing stuff without putting that weight on them. But again, there's just some people who have a hard time stopping running. I know I've worked with them in the past.
Yeah, yeah, absolutely. Yep.
So we have another individual who says they
Mhm,
hear a cartilage sound, which I don't know exactly what they mean by cartilage sound
mhm,
when they're bending, but it
mhm,
doesn't hurt at all. Is it safe
mhm.
to do stuff if they just hear, I guess, some clicking and popping in their joints?
Yeah, so especially in the knee or the shoulder, there's a lot of tendons and soft tissue things in our shoulder, and those things can click, pop, and as long as it's not painful, it's okay to proceed. So a lot of people complain of some anterior knee pain, and sometimes if an activity causes you a lot of pain, that's why we say you need to modify your activity. So it does cause if you know jogging or it keeps flaring things up, then it's probably a good idea to step back to a less intense activity such as biking or swimming. But if you have just isolated popping or clicking in the knee or shoulder, as long as it's not painful, it's probably okay to proceed with whatever activities you're doing. But some of that popping and clicking may be you're not stretching out enough. You're not, warming up in a proper way. So definitely focus on warming up prior to activities. If you do have arthritis in the knee and a little bit of wear and tear, or in the shoulder, sometimes you can have some popping or clicking. But as long as it's not too painful, it's okay to proceed. And I think it's very important to continue to maintain, an active lifestyle. To even if you do have a little bit of arthritis, tell people, I want them to keep moving. I want them to stay active, because that keeps you healthy overall. It keeps the weight off. It keeps your joints feeling better. So obviously, avoiding any high impact activities, but when it comes to just popping, clicking, a little bit of grinding in the front of the knee, as long as it's not too painful and what activity you're doing doesn't make things worse, then it's probably okay to proceed.
Well, thank you so much. You gave us a wealth of information, some great paths for us to take, understanding that things are individual to us, but we also have some generalizations that we want to keep moving. We want to make sure we're doing preventative things. And if anyone
Mhm.
is looking for a fabulous orthopedic, you got the entire office there with the mix of last name. So you can definitely go join the family down there, which I know they'll take great care of you. But we appreciate you taking your time and sharing your expertise and your passion with us. So thank you for being here today.
I appreciate you so much, and thank you so much for having me, and thanks for everybody for logging in.